What's
Hey,
going on?
Joe.
Seems to be going on here.
I brought you a softball player, Joan. Yeah, she's been having problems with her throwing. It's not as good as it used to be. I
Okay.
think she has pain, so
Yeah.
I'll give
I'm
you
fine,
her.
I swear I'm fine.
That's what they all say.
Yeah, she just graduated from high school. She just came in, so
Okay.
you know the high school mentality.
Yeah, I know how it is. All right, man. I'll take
Yeah.
a look-see, and I will
Alright.
let you know what I find. Okay?
Thank you.
No problem. Go ahead and take a seat for me.
Okay. I swear I'm fine.
That's what they all say, but I gotta check you out anyway.
Okay.
It's my job.
Whatever. Let's get
So-
over with.
All right. So what's your name?
My name's Jean.
Jean. Okay.
Jean, like jeans.
Like Jean.
Wear them all
Okay.
the time, yeah.
So how long have you been playing softball, Jean?
Since I was about 8, so about 10 years.
Okay.
11 years coming up.
All right. And so kind of walk me through what's been going on.
I've been playing a lot. I'm a pitcher, so I throw a lot. And my coach, who doesn't give me enough resting time into proper form, gosh, he like I said, he doesn't give me enough time. So I'm doing like 2 to 3 games a day sometimes, and it's just been killing me. Partially too, I don't have the best form because he didn't teach me how to throw. Because I used to be shortstop, so yeah, it's all complicated. But the main thing is that like this past weekend I had to do a doubleheader, and it just my wrist really started bothering me. It started kind of going numb. It was really weird.
Okay. And so when you have the numb sensation, when you kind of have that going on, how long does it usually last? A couple seconds, maybe a minute or two?
It's like at first like it kind of like it was like just right at the end of my throw, and it would go away. But now it's like continuous, like it doesn't go away.
Okay, and are you experiencing that right now?
Yeah.
Okay. Real quickly, you said you used to play shortstop, and now you've converted to playing a pitcher. How long
Yeah.
ago would you say that transition took place?
2 months tops.
2 months? Okay, so it's been relatively recent, your transition
Yeah.
to pitching. Okay. And go ahead real quick if you can, stand up, and I would like you to just kind of run me through your pitching motion, so I can just kind of get a look-see.
Yeah. As you can see, I don't know how to throw, so it's gonna look really bad. But I do my wind up, and then I come up, and I tend to throw really high.
And you have that flexion, that wrist flexion, so that could be just kind of looking at that. That could be a measurement of like the extensor muscles, which are on the opposite side here. Those could be a little bit weak. Maybe we should do some strengthening exercises with those. But you also, the mechanics are a little bit off. Have you ever had any previous injuries to either the wrist or the elbow or the shoulder?
Not really. I kind of had some shoulder problems, like at the beginning of the season. They said like I kind of had like some impingement, but it wasn't really bad. Like it got better pretty fast, but.
Okay, and when you did those, when you had the impingement, did you do anything to treat it? Did you put any ice on it at least, any ibuprofen, anything like that?
I did some strengthening stuff with the other GA or whatever.
Okay.
But I didn't really ever correct my form. I just kind of got some like treatment, and it started getting better, and I kind of just kept doing my old habits.
Okay, but after those exercises that you were doing previously, do you feel like those at least helped build the strength in your shoulder at all?
Yeah, I feel like they helped quite a bit. Like it still kind of bothers me every now and then, but I don't know. I feel like this is kind of part of the job.
Okay, so whether or not, I don't know if your coach has discussed this with you, but obviously being a pitcher, one of the main things that we want to look at is at the shoulder, if there's improper mechanics, maybe a deficit in terms of strength or improper mechanics or anything like that, it could affect your elbow, it could affect your wrist. Everything that goes down from that can be affected and can cause a lot of injuries. A lot of pitchers, you have elbow injuries, you've heard of ECL injuries, things like that that are big. So we want to make sure that you're stable up here, because if you're not, it's going to affect everything down here. It's just a domino effect.
Yeah. That makes sense, though.
So,
Thank you.
okay, so you said that you've been having this numbness, anything like that. So on a scale of 1 to 10, what would you rate your pain right now? 10 being, I gotta take you to the hospital right now.
Like a 3, 4.
Like a 3?
It's not super painful. It just kind of feels weird.
Okay, and how would you describe the pain? Would you say it's sharp shooting pain or like a dull aching pain?
It's more like a dull, aching, kind of numbing pain.
Numbing pain? And does it stay in the wrist, or does it go anywhere else? Does it go up to your elbow, go up to your shoulder?
No.
Go to your fingers at all?
It goes more to my fingers.
More to your fingers? Okay. So after that, I'm going to kind of go through some observational components of my exam. So from here on out, I'm going to kind of go over and look and see what's going on there, and then do some palpations and some tests. Is that okay?
Mm-hmm.
Okay. So starting with my observations, just looking at the injured side, there is swelling and discoloration on the palm surface of her hand, and there's doesn't appear to be any real swelling or discoloration on the back of her hand there. And so, how long have you had this bruising? When did you notice it?
Like, pretty much after the game. It was it's pretty recent. Most of it's pretty recent. Like, not gonna lie, it kind of like was bothering me a few weeks ago.
Mm-hmm.
But like, it never really got bad until after this past day.
Just a situation where you felt like just a little bit of rest, maybe it would go away over time, kind of.
Yeah, kind of.
Okay, I can see that. So, obviously, the first thing I look at is that there's some discoloration and swelling, as I mentioned before. There seems to be no deformity, which is a good thing.
Mm-hmm.
So after looking at those big things here, we're going to move into some palpation and then some special tests. So I'm just going to kind of palpate around, see kind of where things are, and see if maybe anything may be out of place that I can't see, obviously.
Okay.
So let me know if you have any pain. Any pain with that?
It's kind of sore. Yeah, it kind of hurts there.
Okay. Any pain as I move up into here?
It's kind of uncomfortable, but it's not. I think it's really super painful.
Okay.
Other
And is there
than
any
one
pain
spot.
when I go down?
No.
No?
It's pretty good.
Okay. So the pain, so if you take one finger on your other hand for me real quick
Mhm.
and point to the site with most pain.
There.
Okay.
There.
So right where she points, it's right where the median nerve is, which based off of the history of an overuse injury with improper mechanics, the first thing that comes to mind for me is possible carpal tunnel syndrome, which if you've heard of it, people kind of think of it as something like where you're typing at a computer at a desk job and you get it, but it can happen to anybody. Basically, what we're looking at in that case scenario, what you're looking at is you have what's made of called the carpal tunnel, and you have all the musculature in here, and there's a little tunnel that blood vessels and nerves go through that take care of actions of the hand and circulatory and all that stuff. If you have some inflammation in here, it compresses those things, thus can cause the numbing sensation that you're feeling or loss of circulation. So you mentioned a little bit of numbness before, which is another sign that I'm looking at. So I'm just going to kind of test a few things here and make sure that there isn't anything that's more severe in terms of circulation or stuff like that. So I'm just going to check real quick here, just make sure nothing else is impeded, checking for a pulse. I always want to be careful to make sure everything else is intact. Check some circulation here. That's good. So just to cover all my bases, checking pulse and circulation, which is fine. So now, if you go ahead and stick your other arm out for me as well, and I want you to go ahead and close your eyes for me,
Okay.
and let me know. Do you feel this?
I feel it, but it doesn't feel right. Like, something's weird about it.
Okay, and what would you say feels weird about it?
Like, I can't feel the top.
The top?
Like this, my skin I don't feel, but if you press down hard, you can feel it better.
Okay, and when that happened, did you feel any burning or anything like that?
No, not really. It's just kind of numb there.
Okay, so what I'm checking for is I'm checking dermatomes and myotomes with the possible compression of the median nerve, which she pointed to. That's causing some of that sensation there. So I checked sensation. There's a little bit of an abnormal sensation for her. So I'm going to move into dermatomes and myotomes. So I'm going to check the myotome portion real quick. So go ahead and take your thumb and touch to your pinky real quick for me on both hands, if you will.
Okay.
So what I'm going to do here is I'm going to take my finger and try to break you. So do your very best to not let me break you, okay?
Okay.
Okay, that's good. How did that feel? Pain, discomfort with that at all?
Awesome. I'm strong.
Feel
But
awesome
no.
like you're strong?
Yeah, I didn't have any pain or anything with it.
Okay, so go ahead and see your hands. Just squeeze my hands real quick.
Okay.
Just squeeze real hard. Squeeze as hard as you can. You're not going to hurt
Oh,
me.
this is hard like a squeeze.
Okay.
Ah.
Okay, so upon checking dermatomes and myotomes, sensation is a little bit off, and the strength seems to be pretty good. There's a little bit of a deficit on the left side, which is her affected side, which is also confirmed for me by doing a squeeze test, which she was not able to provide as much compression force with her left hand as well. So there's a little bit of lack of grip strength there. And have you noticed anything like that when you're gripping the ball? Any lack of being able to hold the ball tightly, anything like that?
Yeah, I've noticed that, holding the ball, the ball's gotten really heavy, and it's never been that heavy before. And like I feel like definitely like my last practice, like I think that's kind of why coach called me in here, was because I kept dropping the ball a lot. Like, I couldn't like hold, like I would short it because I would like get underneath and like couldn't hold it. And then drop.
Okay. So one more thing, another thing I want to check real quick, just because of the discoloration on the palmar surface of the hand. I just want to be sure to rule out any possibility that there may be a possible fracture of any of the carpal bones in the hand. So I'm just going to take the tuning fork, and what this is going to do is I'm just going to strike it. I'm going to press to your hand, and I want you to let me know if you have any pain. Okay? Any pain with that?
Not really. Just the pressure kind of feels weird. It's not like radiating well.
Pain with that?
Not really.
Any pain there?
No.
So that's a good thing. That's a positive sign. What I'm looking for there is when I strike the tuning fork, the vibrations, when I press it against your skin, the vibrations will make those bones rub together, and if there's a fracture, that'll be very painful, to the point where you might want to punch me in the face.
No.
But the fact that you don't have any pain is a very good thing. I'm just going to run through one last time, and I'm just going to go through some joint play of the carpal bones and look to see if I find any possible false movement or any joint instability. How does that feel?
It feels fine.
Okay. Okay. So go ahead and relax there.
Alright.
So upon looking over some more joint stability stuff, there's no false movement. Everything seems to be okay there. So I'm kind of crossing off the possibility of lunate dislocation or anything like that, possible fractures of carpal bones in the hand, which is good. Which makes me lean more towards the possibility that it is carpal tunnel. So one of the things that we're going to stress over the next few days is I want you to come in and we're going to work on a couple of different things. We're going to work on these muscles, which are your extensor muscles, because as you talked about, as you let go of the ball, you're forcing it and it's taken off on you, which you've said a couple times. So my belief is that your flexor muscles right now are stronger. There's a muscle imbalance there.
Okay.
So these muscles being stronger are being able to take over when these muscles should be able to stop that movement. So we're going to work on some strengthening exercises with the extensor muscles of our left hand. Also, we're going to work on some grip strength to help get your grip strength back, because that's obviously key as well. One of the simple ways that we can do that is you can grab like a 5-pound weight or whatever you feel most comfortable with, grab it in your hand, let your arm hang out by your side, and then just rotate.
Okay.
And just keeping that tension there on that weight and holding it still as you rotate will help increase the strength in those muscles, because the muscles right there, they're very small, and so it won't take much in terms of a weight to help provide that.
Okay.
Also, you can use one of those forearm grips and just kind of squeeze, and that'll kind of help deal with some of the strength that's there, help with grip strength and things like that as well. So basically the timetable that I'm looking at is a 2 to 3 week window. What I want you to do is we're going to come in every day, we'll go through those rehab exercises, make sure range of motion stays where it's at, make sure strength increases, and then we'll do that every day. And after you come back from practice, we'll put some ice on it, we'll ice you after practice, and we'll look to see if it gets better. If you feel like the symptoms are staying the same or possibly even getting worse over the next 2 to 3 weeks, then we will have to refer to a physician, because there may need to be possible surgery.
I don't want surgery.
We don't want surgery either. So for your sake and for coach's sake, for the team's sake, we want you to make sure you get better as fast as you can. And so we're going to try to avoid surgery. I don't think you will need surgery, but like I said, if symptoms stay the same or get worse over the next 2 to 3 weeks, then we may have to pursue that. All I can control is when you come to see me. So if you come and see me and you're ready to work, we can work on that, and hopefully with those exercises you'll notice the symptoms start to go away. Biggest thing is after practice when you're at home, because if it gets inflamed, it's going to affect your everyday life, everything else that you do. So when you get home, make sure that you can ice 20 minutes on for every hour. You can take it off, and then ice as you need to control the inflammation that's building up there. You have some edema on there. Also, we could put maybe some kind of compression on it to help kind of get some of the fluid out of the area as well. So that way that doesn't possibly limit range of motion. And then hopefully within the next couple of weeks you'll be fine.